This is The Weekly on ClickOrlando.com with Justin Warmoth.
Good morning, I'm Justin Warmoth. Every year, millions of tourists visit Florida, but a decade ago, people from out of state were coming here not for a beach or theme park vacation, but to buy cheap and easy prescription painkillers. The state had little to no oversight, and it is a big reason we are in the middle of an opioid crisis 10 years later. This morning, Seminole County Sheriff Dennis Lemma is here to talk about the work being done to curb the deadly epidemic. Sheriff, thanks for joining us this morning.
Thank you for having me.
You know, there's a lot of talk right now about the opioid epidemic. You are at the forefront, both here at the local level in Seminole County, but at the state level as well. Talk about your role when it comes to the opioid crisis facing Florida.
Yeah, we recognize the impact that this has on our community. Without question, there's a direct correlation between substance abuse, addiction, mental health, and crime and quality of life in our community. And this is one of the reasons why Attorney General Ashley Moody and First Lady Casey DeSantis have made this a priority for them. In Seminole County alone, you know, one of the most affluent counties in the Central Florida area, you know, we had more than 400 overdoses last year and an unprecedented number of deaths with more than 80 deaths. So if you take, to put it in perspective, if you take every person who has died as a result of a motor vehicle crash or accident, and every person who's died at the hands of a firearm, either self-inflicted or through violence, the amount of people who have died from an opioid-related overdose is twice as many as both those vehicle crashes as well as guns.
You know, there's some really interesting data that was released that takes us back 10, 20 years ago. What did you make about that data and how the opioid crisis really started?
Yeah, you know, we're not surprised at all by the data that was recently released. Actually, we closed down some of these pharmacies back, you know, 10 or 15 years ago. We knew that in 1996, that marketed wonder drug of Oxycontin came out. And if you look at the mapping of that, you can look, like in Seminole County alone, you know, there were millions of pills out on the street. And then you look at the pharmacies that are prescribing them or giving them. There's no question that the people who were involved in this process knew that those pills were being diverted out onto the streets for criminal use. If you take the map of the amount of pills that were in our country, billions of pills, and the overlay of the deaths, there is a direct correlation with that. So it is an epidemic. When we closed the pill mills down, when Attorney General Pam Bondi you know, put into effect the prescription pill monitoring system, and we locked up the illegal prescribers, and we educated the legitimate doctors on the damages that this was causing. One of the things that we did not do is understand the effects of those tens of thousands of people who were already dependent on opioids, who had already become addicted.
People were coming to Florida from out of state because they knew Florida had a loophole, maybe I don't know if that's the correct term, but they knew that they could get those drugs here in Florida.
Yeah, so Florida was home to nearly 850 pill mills across the state. And at one time, more than 90% of the prescription opioids that were on the street were prescribed from a pharmacy here in the state of Florida. So, I mean, they would travel down from every contiguous state to participate in what was referred to at the time as legalized drug dealing.
So just no oversight?
Absolutely no oversight. And the people who should have been watching this weren't watching it. And I think it's because of the mighty dollar. As long as the money was coming in, they were going to do whatever they could to make sure that that was sustained.
All-time low reported in crime, right?
Right.
We're at that point.
We are.
But addiction is at an all-time high.
Yeah. So you look at this, I mean, we've been blessed across the state of Florida to have historic lows in crime rates. In Seminole County, the crime rate in the history of the county has never been as low as it is right now. But at the same time, we see this social epidemic. When I first got into this business, you would never even think of carrying medicine on your gun belt to literally bring people back to life. And just the last year, I've awarded hundreds of deputy sheriffs in Seminole County alone with the life-saving award. And this is not unique to our jurisdiction. It's occurring across the country. We know that naloxone and Narcan, bringing people back, it's a huge part of what's going on. But we know now that the number one predictor of whether or not somebody will overdose and die is whether or not they've overdosed and lived. And we have to provide unique services to that at-risk population. This is a situation where 80% of the people who are now dependent on opioids were at one time legally prescribed the drug by somebody that they trusted, typically their physician.
When someone is revived from Narcan, right, and they get taken to the hospital, what do the next 24 to 48 hours look for them? Are they just released, and then are they educated at all at this point?
Well, that's a very interesting question, and one up until this point, they would be stabilized on the streets, either by law-abiding citizens or first responders. They would be taken by way of ambulance to the local hospital. They would be treated by emergency room physicians. And at that point in time, many of them were released back into the same environment that they overdosed in the first place. What we do in Seminole County now is we have a Seminole Collaborative Opioid Response Effort, which we respond to every overdose situation immediately to help not only that individual, but that individual's family and loved ones navigate the system to get them right on the path back to safety. If you look at the state of Florida, we spend nearly $2 billion in substance abuse and mental health services. What the First Lady has me doing now is chairing her prevention panel that is going to look at all of those services to make sure that they are modernized to meet the needs and the demands that are relevant today. And you can't wait on government to solve this problem. Government typically is bogged down with bureaucracy and red tape. This is a public-private partnership, and I will tell you the DeSantis administration is all about making bold steps and getting things done.
So some of these people aren't taken to hospitals, though. They are taken to jail, right? If they're found with prescription drugs, opioids on them that they're not allowed to have, they are taken to jail. Is there a way to educate them while incarcerated? Is that something that you guys are doing?
Yeah, so we've created, as a part of our comprehensive plan to address this, we created an OPOD. It's an opioid substance abuse program that deals with medical assisted treatment, cognitive behavioral therapy, and kind of a nurturing type of environment. Not to be confused with an easy environment, because it is a military style, very regimented program where people are required to meet certain standards. But as a father and a husband and a citizen, there's an expectation that when my neighbor or somebody living down the street from me gets locked up, that somebody on the inside is trying to fix the behavior before they come back into my neighborhood. And when we look at jails, I rarely ever use the word jail, because to me, jail represents the brick and mortar that holds people in, but correctional facility represents the behavior that should be demonstrated on the inside. These people are going to come back out, they're going to come to our neighborhoods, and what we want them to do is to not commit crime, not to have our system support them and their families based upon their addiction, and that's what we're going to try to do.
Coming up, Sheriff Lemma will discuss where the dangerous drugs are coming from now and how business leaders in the community can help out. Keep it here.
This is The Weekly on ClickOrlando.com with Justin Warmoth.
Welcome back. This morning, we're looking at the opioid epidemic, how it started, how bad it is, and how law enforcement is working to fix it. Seminole County Sheriff Dennis Lemma is back now with how people in the community can step up when law enforcement isn't around. So if someone is a business owner, say, or along those lines, a manager, is there something that they can do that maybe they see the warning signs a little bit, but what can they do to help out with this crisis?
Yeah, that's a great question. I'm working with Andre Bailey here in Orlando on a project Opioid, and it involves the business community to go out there. And if you think about it, sometimes the first opportunity that you can see the effects of substance abuse may be at the workplace. I mean, somebody who is there for 50, 60 hours a week in some cases, their supervisors and coworkers may be the first person to see that, Dennis is not acting the way he normally acts. And knowing what resources are available to guide that individual outside of the typical employee assistance program, knowing the signs to look for is a big part of what we want to accomplish.
Today's opioid, when we say opioid crisis, we're talking about heroin for the most part, right? But fentanyl is the one that is a killer.
Yeah.
Can you talk about the difference in potency between those, because it's staggering.
Yeah, so if you look at some of the stats, you can get excited and say it looks like the overdoses are being reduced across the country. Although there's some areas where overdoses are being reduced, overdose deaths are increasing. And the reason why is because a lot of the drugs, especially some of the recreational things, are now being laced with fentanyl or carfentanil. And to put it in perspective, is fentanyl is 100 times more potent than morphine, 50 times more potent than heroin, and heroin's some bad stuff. Carfentanil is 100 times more potent than fentanyl. So just a little tiny bit could kill a room full of people. And this is so dangerous. And we're reviving people who are using other types of recreational drugs. And we ask them, how long have you been using an opioid? In many cases, synthetic opioids. And they are saying things like, I smoke marijuana, or I use cocaine. I had no idea that that drug was laced with these other substances.
Seminole County holds those people responsible, though, the sellers who kill people.
Yeah.
First-degree murder they're charged with, right?
Yeah, 13 people that we've charged with first-degree murder for dealing deadly doses of drugs. And looking at this comprehensive approach is I think that my law enforcement colleagues across the state want to continue to be tough on the drug dealers, the people who are dealing in poison and influencing and targeting the most vulnerable of people. Need to be held accountable to the full extent of the law.
Where are those drug dealers getting it? Where is all this coming from? Do you see it?
Yeah, so despite what people may say, a lot of the heroin is coming from Mexico, and the synthetic opioids are coming from China. I mean, people are getting them here to the country. I know that there's a big discussion about the border and trafficking, but there is definitely a problem with drugs coming in from other countries and then hitting our local streets.
It's interesting, you were touching on it a little bit ago, talking about law enforcement in the 21st century. You had a great quote where you say, we're not just chasing bad guys, bank robbers anymore. This is what law enforcement is doing in the 21st century.
Yeah.
It's a major focus.
We are absolutely convinced that crime and delinquency in communities are symptoms of other problems. And if we want to make our community safer, we must address the underlying conditions that are present to lead people down that path in the first place. We know that mental health and substance abuse are always going to be high on that list.
How difficult for someone who maybe they don't deal with this in their house or the people that they know, when someone is addicted to these drugs, this is a process that could take years to wean them off, right?
Right. So what we know from talking to addiction specialists, if you think just simply abstaining or going to a 28-day program where you're going to ride horseback up and down the beach is going to be what works for you, that is very unlikely. Although it may occur in some cases, it's very unlikely. We know that medical-assisted treatment actually works. We know that cognitive behavioral therapy works. And we have to take a more sophisticated approach in providing people the help and medicine that they need. If this is truly a medical illness, and addiction has no prejudice. How many people do we know as law-abiding citizens that have tried to quit the addiction of nicotine, unsuccessful year after year? And some of these individuals are the most successful and law-abiding people there. The opioid is even more addictive than nicotine, so just put it in perspective for you.
This epidemic is not going to go away overnight. It is a slow process, but what will it take? Is it a more focus on the drug dealers and the fentanyl that's that's being dumped into these synthetic opioids, or is it going to be educating the public and getting people help that are addicted to these drugs?
I think a combination. Okay. I think that the bad guys need to go to jail, and they need to go to jail quickly. I think that education needs to occur because what we know right now is more than 10% of our population is genetically prone to addiction. We just don't know it. And this is one of the reasons why somebody can take a prescribed opioid and say, that was wonderful, I didn't feel any pain at all. And another person can say that I'm sick to my stomach by taking this. We know that 1 out of every 3 people have a personal story of a family member or close friend navigating a path towards recovery. And I think that the first step is to make sure that the drug dealers are held accountable to the full extent of the law, and to make sure that we work hard to change the face of addiction. Think about the numbers. 80% of the people who are now dependent on opioids were at one time legally prescribed. I'm talking about a lot of military veterans, a lot of sports-related injuries, a lot of athletes. changing the face of addiction is a huge part of it. These are not people who are living under the overpass. These are people who are in need of assistance. And when we look at it, the greatest responsibility that we have as a free society is to protect and preserve human life. And that's what we're trying to do here.
I do want to ask you, while you're here, about school safety. Obviously, school starting in just a few weeks, believe it or not, summer's almost over. Yeah. Is there anything that parents need to be aware of when it comes to their child's school and maybe some of the changes that have been made over the summer?
Yeah, so we are very excited about some of the changes to provide a safe and secure environment for our kids to learn. I think that each jurisdiction has a different approach on how they're handling it. Like up in Seminole County, for 3 or 4 years, we've had a dedicated school resource deputy on every single public school campus in Seminole County. For the high schools, we've doubled those people up in every campus that has more than 1,000. But what I would encourage parents to do is to make sure that they build a relationship with the individual campuses and those police officers or deputy sheriffs, or in some cases guardians for counties that haven't moved towards the dedicated law enforcement officer. But what works for us the best in Seminole is to have that bona fide law enforcement officer, because our role there on the campus extends beyond school safety. School safety is a priority, but we want to have preventative classes and training, and we want to be a resource for the faculty and staff and students for the people who are on those schools.
And we see threats over and over. Is there something that you can do to maybe prevent someone from doing that?
So let me, when people do it, we try to do all that we can to make an example out of them, to kind of deter that type of behavior in the past. But inevitably, as sure as we're sitting here, here's what will happen. In the first few weeks of school, a school district around here will see a note on a bathroom wall. The crime line phone number will ring off the hook, and people will call in their local law enforcement agency and say, is it safe to send my children to school? Inevitably, look, I get it. I'm a dad and a husband myself, I get it. I tell people all the time, it is safe to send your children to school. If there's ever a credible threat, you would see the local sheriff, the local police chief, and the school superintendent getting on, closing the campus, doing whatever necessary.
And back to the topic of opioids, Sheriff Lemma wanted me to mention the Good Samaritan law. He says witnesses to an overdose often hesitate to seek help or call 911, fearing police involvement. The Good Samaritan law provides immunity to those witnesses. For more information on the opioid epidemic and the topics we discussed this morning, just head to clickorlando.com/weekly. I'm Justin Mormith. Have a great Sunday.